and we don't like any limits. But in fact, we have limits. And I will show you, as a nephrologist, from my perspective, from my clinical perspective, treating patients with various water and electrolyte imbalances, I will show you that there are certain limits that even water can kill. Lack of water for sure, but even pure water can also kill. So I will show you it's from the perspective of the runners, especially from the perspective of the people who not only run marathons but also ultramarathons and think that there are no limits. Our attitude towards hydration has changed in the past decades a lot. And you always see the sportsmen, but not only the sportsmen, but also the children. Everybody who train uses a lot of water. It's good, but it can also be dangerous for some. So it's not the indication for everybody. So this is the general recommendation from the US, that all fluid we take every day should be around 3 liters for an average woman, and around 4 liters for a man. So it's true, but we have to remember that it's not only the water, but it's also the water consumed from food and all other drinks. Hydration, of course, is critical for exercise. And hydration is critical to achieve a good performance. This is the slide that shows that there is a decrement, in fact, in submaximal aerobic performance when somebody is dehydrated, especially when it takes place in a high temperature. This is the how much weight we can lose during the run. This is 5K, 10K, 21K, and a marathon run. So you see that in a temperature of 22 degrees, if somebody wants to run 32 kilometers for 4 hours and a half, it will lose about 2% of body mass. In a temperature of 30 degrees, it will be the loss will be much higher. And if someone wants to run faster and can run in 200 minutes of 32 kilometers, the loss of the body mass will be even greater, reaching 4% in the temperature of 30 degrees. So hydration is critical. It's especially critical for the extreme long-term exercises, for marathon runs. I can say that marathons became so popular that it's not treated as a long run, but it is. But there are ultramarathon runs. So every run over 42 kilometers is an ultramarathon, but sometimes they last for several days. There are large differences in altitude, elevations, weather conditions, temperature, and humidity. There are cycling marathons, and there are, of course, triathlon in the toughest Ironman variant. So this is just the few examples of the most crazy ultramarathons from Antarctica to Death Valley. You see that there are usually distances over 200 kilometers. This is one of the toughest. Successfully, only 11 men were able to finish this ultramarathon. But the problems with the hydration, like dehydration, overhydration, are frequent in such high intensity and such long exercises. They come in different combinations with sodium disturbances. And in fact, the sodium is what really makes it very dangerous. So I will show you the 2 examples of the people who we think that they should be experienced, because they were very experienced as runners. But this is just the problem, that if someone thinks that there are no limits. This is Grand Canyon. This is the very popular place of one of the toughest ultramarathons. But in fact, the conditions are extreme, especially during summer. This is the, if you go to the deep into the canyon, you will see the small board describing the story of the girl. She was a medical student, and she died because of dehydration and probably hypernatremia. She died in 2004. A few years ago, she was within 30 women who were the fastest in the Boston Marathon. So she was very well prepared. And she went for a 30-mile run and the temperature was around 40 degrees. And the most important part is here. I will enlarge it a little bit. She carried 1.5 liters of water, 2 energy bars, and 1 apple. So it caused the disaster. It's a story which every ultramarathon runner should remember. A completely different story of the woman who was not a runner, but she died of so-called water intoxication. It was very stupid competition. Hold your Wii for a Wii. This is the play game console. So the participants were asked to consume 226 milliliters of pure water every 15 minutes, and the winner was the last that had to give urine. And Jennifer drank only 5 bottles, and she died of brain edema. And of course, it finished with the big money that the radio broadcaster had to pay for the family of the victim of this stupid competition. It shows that even the pure water can kill, and I will show you why. It resembles, in fact, the Middle Age water tortures, that was called toka. And even if during that times it was known that the amount of pure water that is given to the person who is tortured should be limited to the 8 liters of water. But many judges were very dedicated to their job, and most of these poor people died. So what are the disturbances? The people who perform recreational sports, but in an extreme way, so marathons, ultramarathons, triathlon, could experience 2 major disorders of sodium balance. One is hypernatremia, and the other is hyponatremia. Hypernatremia could be because of dehydration or just a consumption of fluids with high sodium content. It's some attention should be paid on so-called isotonic fluids in subjects who lose little sodium with sweating. In fact, we lose different amounts of sodium with sweat. It's highly variable, and there are high interpersonal differences. And hyponatremia and water poisoning, I just showed you the example of water poisoning, and the main cause is drinking of low electrolyte or electrolyte-free, like pure water fluids, particularly in subjects with excessive loss of sodium with sweating. In fact, sodium is very narrowly regulated. It's the most tightly regulated ion in the blood because the normal level is between 135 and 145. It's just 4%. So it's not unlike it's completely different than other ions. And disorders such as low sodium, so hyponatremia and hypernatremia, are very dangerous and give symptoms, but only if they are acute. If they are acute, they are usually treated, but of course it requires a careful investigation before any treatment is undertaken. So why this poor woman died because of brain edema when she was drinking pure water? It was because of hyponatremia. Hyponatremia leads to brain edema. It's because water can freely move between the cell and from outside, from extracellular space to intracellular space, just to compensate for the difference in the sodium concentration. In this case of hyponatremia, water comes into the cell and causes cell swelling. It's not dangerous for all parts of our body, with the exception of the brain. And in fact, we have some reserve, but we have the skull that prevents brain from further enlargement, from further swelling. And it's dangerous, mostly, the most dangerous is in children and in premenopausal women. People who are getting older, their brain is getting older as well, is shrinking, so the reserve is increasing. So they are very resistant to hyponatremia and brain edema because of hyponatremia. In the example I just showed you was the young woman, and she had a very small reserve. But it's most dangerous in children. Hypernatremia is a completely different problem. In this case, in fact, the brain cells and other cells in the body shrink. And it causes some symptoms, but symptoms are not typical, not characteristic for the disease, for the problem, for the disturbances. But in fact, it can cause, in extreme cases, it can cause intracellular hemorrhage. It results from the brain shrinkage and damage to the vessels that surround the brain. So hyponatremia is the problem that, in fact, it's rather common in the persons who run or who cycle for a long time, have very intensive exercises, prolonged exercises. It's called exercise-induced hyponatremia. It was first described in 1985. Until 2010, there were 5 deaths recorded that were attributed to exercise-induced hyponatremia. There were also 4 additional deaths among soldiers during high-intensity training. It was probably also the reason of the death of the first, let's say, marathon runner, because he was very dehydrated. He had to run in a very high temperature. There are various publications on the prevalence of exercise-induced hyponatremia, and it ranges from 0 to 44%. This is the most famous description of the hyponatremia among marathon runners. It was in 2005. They published the results of the measurements of the serum sodium performed among runners in the Boston Marathon a year before. So it was a pretty large group, but in fact the mean serum concentration after the run was exactly in the middle of normal, 140. But the range was from 114 to 158. 13% of runners had hyponatremia. In fact, when we think about running for a long time, especially in a high temperature, we always think about hypernatremia, because people should become dehydrated. So hyponatremia is something surprising. Why it happens? Serum sodium was defined as serum sodium less than 135, so it's below the normal. But only 3 runners had severe hyponatremia, had serum sodium of 119, 118, and 114, really life-threatening. So, but it's not so. So what's interesting? Interesting is this result, because in fact this is the white change, body mass change during the marathon run, and in fact the risk of hyponatremia was much higher in persons who gained weight during the run, not lose. So it seems that most of the runners drink too much fluids, a lot of fluids, because they want to prevent hypernatremia and dehydration. But they exaggerated a little bit. And in fact, most sportsmen who develop hyponatremia, this is the largest cohort of the patients, of the people who develop hyponatremia, exercise-induced hyponatremia, show body mass increase after the run. But if you see at the white changes during the runs, you see that sometimes they are extreme. Some people lose 12% of their body weight, and some gain 8 or 9%. So but mostly those who had an increase in body mass had hyponatremia. There is also an experience from triathlon. This is from the Ironmen European Championship, recently published in the New England Journal of Medicine. This is the letter. So also among the people who performed, who took part in the Ironman and finished, had hyponatremia, and the prevalence was about 11%. But fortunately, the same story as with Boston Marathon, only 3 had critical hyponatremia. So it's not so dangerous as previously thought. And the authors concluded that exercise-associated hyponatremia can occur in a considerable percentage of long-distance triathletes, but females are mostly prone to the development of this problem, with a racing time of 9 hours or more. So the longer run, the higher risk of hyponatremia. So the risk factors of exercise-induced hyponatremia is prolonged exercise, female sex, small body mass, excessive hydration. It means access to unlimited drinks during exercise, and overhydration at the beginning of exercise. Everybody is so afraid of getting dehydrated that drinks too much before the run, and starts the run going to the toilet every 5 minutes just before the run. This is also my personal experience as a marathon runner. So I know, and I look at the colleagues, how they behave just before the start. They are nervous, but not only because they're nervous, they're overhydrated, and they had to go to the toilet every few minutes. And of course, extreme conditions, either very high or very low temperature. There are many recommendations on the hydration during exercises, especially prolonged high-intensity exercise. This is just one of the recommendations, but it's important to try to keep body mass constant, or achieve small losses of about 1 to 2%. It's the safest. Not to gain so much weight, not to lose more than 1-2%. And it's recommended that the exercise that lasts longer than 30 minutes, it's necessary to drink fluids containing carbohydrates and electrolytes, or solely or in addition to water, mixed with water. And of course, there is high inter-individual variation in water and electrolyte losses. So in fact, each runner, even those who run for recreational reasons, should be examined for the body mass change during 1 hour of running in a controlled temperature and humidity. We can just do such self-test. It's not so difficult to perform. This is the common misbelief that isotonic, so-called isotonic sport drinks provide a lot of sodium. So they put the person at risk of hypernatremia. In fact, this is not the case. This is just the popular so-called isotonic fluids. If you look at the, mostly it's provided, its tonicity, I could say, is provided by the carbohydrates. If you look at the sodium concentration, it's just between 12 or 10 to 36 millimole per liter. Our normal sodium concentration is between 135 to 145, and 0.9% so-called isotonic sodium solutions provide 150, or more than 150 millimoles. So it's in fact not so rich in sodium. So to conclude, hydration is important before, if not excessive, during and after physical exercise. This is critical for safety and performance. For especially, I would like to put the stress on safety. Each intensive exercise lasting longer than 30 minutes requires hydration with water and isotonic fluids. 2% mass loss is the threshold that could be tolerated, but too much body weight decrease or increase could be dangerous. And of course, we should look at ourselves, at our physiology, our change in body mass, urine color, and thirst. This is the very important to know that it's the most important mechanism that regulates sodium and water balance. Thank you.